Hi, I'm Dr. Meti. Today I want to talk about telemedicine in Ghana. Not as an expert, but just to wonder why I hardly hear of patients subscribing to telemedicine as a way of consulting for health related conditions. I mean, I'm yet to come across a patient in the consulting room who yielded this information about accessing health from a telemedicine company instead of what we are usually used to hearing, like they went to a herbalist or some other facility, or they spoke to, let's say, a friend, pharmacologist, or a doctor. And why is it not booming, the telemedicine? Why is it not doing so? Well, probably I'm wrong. Probably people are using it and they're not talking about it. I really, really want to know your experience from wherever you are because I'm only just curious. I thought about telemedicine seriously during the COVID era when we were all mandated to stay at home. Yes, health workers were working, but most of civil society were forced to stay at home. And it was becoming a challenge for patients to access healthcare givers. People died. Other conditions got worse, especially diabetics, hypertensives, who could not access facilities readily, where a lot of facilities had shut down and it was only emergencies that were attended to. So during that period, it became very necessary. I thought like, oh, if it was very, very possible for doctors to be reached via phone, internet, or any other convenient means, uh, that would have been great. Without technically telemedicine, it's been around for quite a while, and I wonder how many people have got a telemedicine app on their phone or gain access to a popular telemedicine app and used it. Um, if you have ever used it, share with me your experience and how easy it is. I looked up the, the list of top 10 telemedicine startups in Ghana. I came across Telehealth, MedPharma, Nkomo, Visa Health, Hewali, Dr. Now, GH, Claron Doc, and others. And most of them were located in Accra. The year of establishments range from 2016 and as early as 2022, no, and even 2022. So none last year, none this year, and some of them are actually non-functional. And I'm just wondering how anyone could access telemedicine and their experience. It's amazing how sometimes we talk about the technological barriers, but um, average people have TikTok accounts, Facebook, YouTube, but I'm wondering the technical difficulty that's probably just my thoughts is making people unable to use telemedicine. Because ideally, on a regular basis, most patients will want to have a doctor's phone number so they could reach out, ask questions, talk to a doctor when they are in times of need. However, almost nobody I have managed, let's say in the past 2, 3 years, or as far back as my memory can recollect, has ever told me that he or she uses a telemedicine app. So, what is the main problem? Is it a viable source of healthcare? Can patients really, really benefit palpably in order to rely on it as a source of accessing healthcare. And so, out of curiosity, I'm only asking. Probably I'm asking the wrong questions. Probably I'm ignorant. What's your experience in your country? Telemedicine. How likely is it for a patient to go on the app and reach out to a hospital? The idea is quite beautiful, but the actualization, hardly have I heard of anybody talk about it. Hardly. So let me know your experience. Telemedicine, because I believe it has some promise when it comes to delivering healthcare. Not everybody can can and will want to come to a hospital, queue up, especially the long queues. It's been a source of great distress. Some people will not come at all. We have all kinds of facilities mushrooming all over the country, advertising their services on radio, television, billboards, offering to offering services um, that's most often is not standard. You've not had any medical training at all, but um, people accept their care they give and pay for it anyway. But a medically trained doctor who has a license to practice, whose practice is regulated by the Medical and Dental Council, is hardly visible except in a hospital, whether government or private, or let's say office practice. Why is this so? How come nobody seems to know where the doctor is, except for institutions like hospitals? How are doctors not accessible? How do you get access to a doctor? His contact. And of course, I understand most doctors are not comfortable giving out their phone numbers because, of course, you don't have a business arrangement with a doctor. And plus, the inconvenience of calling a doctor at odd hours is an ever present challenge. And so most doctors are reluctant to give out their contacts. But I think that if it was a paid service and you could schedule a video or audio consults with a doctor, then why not? It's paid service. So the doctor could decide with the patient on an appropriate time to render the consults and then manage the patient the best way possible. It's very, very interesting that even among surgeons, and I've said this time without number, our interactions with patients usually, commonly, most of the time, does not involve the need to even operate on them. A lot of the time, we have to deal with issues related to evaluation of labs, history taking, physical exams, evaluation of labs, evaluation of medication, follow ups, stuff like that. It's only a small percentage of the time in our engagement with patients that we have to go to theater. So it means that even if you break down our interaction with patients, I mean the physical interaction with patients, if much of it hasn't got anything to do with going to theater or even touching the patient, then why can that service not be migrated onto telemedicine? But again, that has always been a fantastic idea. But why is it not working? I'll be trying to evaluate this, comparing notes from different countries and see why the existing apps are not doing well and whether there is any other way around it so that we can still render an affordable paid service, of course, to patients. Doctors are here, we've been trained, we have knowledge, we have access to information regarding pharmacies, labs, and all the moving parts that is involved in delivery of service to the patients. And I think that patients not knowing where and how to get help because they have no access to a doctor unless you go through the patient goes through the traditional either referral system, getting to the hospital, having to queue up before you get to see a doctor. Because that route is too long for a lot of patients and it's an inconvenience a lot, we are not giving the best. I think there's a lot of promise in telemedicine, and it's very, very possible that the future of healthcare has to really move out from face to face interaction to the online platform. I think it's underutilized, and I'm willing to learn. I'm willing to learn. I just want colleagues out there to share their experience so that we can help patients and deliver good services.